responsibility to contribute to proper behavior and to adhere to public health guidance to protect themselves and others, as well as to help control the spread of COVID-19. Public health controls are only as effective as the willingness of individuals to carry them out. To complement our public health mitigation efforts, the federal government has allocated 150 million Abbott Buy Next Now antigen rapid tests. The federal government, through Abbott, has directly shipped 50 million tests across the United States to personal care facilities, skilled nursing facilities, historically black colleges and universities, home care and hospice organizations, and the Indian Health Service. Of the 100 million remaining tests, Pennsylvania is being allocated on a per capita basis over 3.8 million Abbott Buy Next Now antigen rapid tests from October through the end of December. That's approximately 250,000 tests per week. The Abbott Buy Next Now distribution plan includes identifying vulnerable populations in Pennsylvania counties that demonstrates substantial risk for community spread of disease. Weekly distribution occurs to these counties that are at a substantial risk, approximately 6 counties per week, but also prioritizes those counties that have current outbreaks. Pennsylvania's COVID-19 testing goals remain to ensure testing is accessible to all Pennsylvanians with symptoms of COVID-19, making certain they're available by increasing supply and building community capacity, and adaptable to the ever-evolving landscape of the virus and the data we receive. To achieve this, we plan to utilize Pennsylvania's existing public health infrastructure to implement the COVID-19 prioritized tiered approach to comprehensive testing throughout Pennsylvania. This network covers the entire Commonwealth with over 550 contracted sites and over 400 public health sites, to include federally qualified health centers, where 1 out of 14 Commonwealth citizens receive health care services at over 300 sites in 52 rural and urban counties throughout Pennsylvania. Our county and municipal health departments, who provide public health services to over 40% of Pennsylvania's population, and our Department of Health's network of state health centers that are strategically located in nearly 60 of Pennsylvania's counties and provide public health clinical services. They will be partnering with contracted testing providers throughout their network. These are all well-known and trusted providers who maintain an understanding of the community by serving as local leaders. They have partnerships, networks, and already existing collaborations with both public and private community resources. This public health network currently prioritizes the most vulnerable, underserved, and special at-risk populations, which are also our COVID-19 priority populations, and already have direct access to use our PA-NEDS, which is an electronic disease data surveillance system for required disease reporting. Bolstering our existing public health infrastructure prepares for sustainability to address continuing and emerging public health threats. As more sites become available, they will be added to the Commonwealth's map of testing sites that can be found on the Department of Health's website. Another tool to complement our mitigation strategy is case investigation and contact tracing, which are vital public health tools used in the process of supporting patients with suspected or confirmed infection and controlling disease. In case investigation, public health staff work with a patient to help them recall everyone with whom they have had close contact during the time frame while they may have been infectious. Public health staff then began contact tracing by alerting the exposed individuals or contacts of their potential exposure as rapidly and sensitively as possible. To protect patient privacy, Contacts are only informed that they may have been exposed to a patient with the infection. They are not told the identity of the patient who may have exposed them. Contacts are provided with education, information, and support to understand their risk, what they should do to separate themselves from others, monitor themselves for symptoms and illness, and the possibility that they could spread the infection to others even if they do not feel ill. Contacts are encouraged to stay home and maintain social distance from others at least 6 feet until 14 days after their last exposure, in case they also become ill. They should monitor themselves by checking their temperature twice daily and watching for cough or shortness of breath. To the extent possible, public health staff will check in with contacts to make sure that they are self-monitoring and have not developed symptoms. Contacts who develop symptoms should promptly isolate themselves and notify public health staff. They will be evaluated for infection and the need for medical care. Time is of the essence. Identifying contacts and ensuring they do not interact with others is critical to protect communities from further spread. If communities are unable to effectively isolate patients and ensure contacts can separate themselves from others, rapid community spread of COVID-19 is likely to increase to the point that strict mitigation strategies will again be needed to contain the virus. So again, contact investigators and contact tracers immediately identify and interview people with COVID-19 disease. They support isolation of those who are infected. They alert contacts of their exposure, assess their symptoms and risk, and provide instructions for next steps. And most importantly, link those with symptoms to testing and care. Currently, over 5 million tests to over 40% of Pennsylvania's population have been accomplished. This creates a significant challenge to reach all positives. Therefore, we're prioritizing case investigations to ensure those who are most vulnerable or could lead to greater community spread or outbreaks receive a case investigation first. This prioritization is vital during the current surge in cases. People are urged to answer a call from a case reviewer and to provide as much information as possible. Case reviewers are trained public health professionals with specialized skills and a thorough understanding of the need for patient confidentiality. The COVID-19 pandemic will continue to evolve rapidly as the tools, research, and data are improved to protect public health. As more information becomes available, we will continue to refine our approach based on scientific evidence and input from communities in Pennsylvania. The Commonwealth will continue to review where the greatest need for testing is and leverage mobile testing capabilities when possible to ensure flexibility in the testing response. So please remember, wear your mask, wash your hands, social distance, download the COVID-19 Alert app, avoid large groups, and please hold holiday gatherings for your immediate household only. As Governor Wolf says, COVID-19 is tough, but working together, Pennsylvanians are tougher. Thank you. I'll now take questions.
Thank you, Director Huff. Our first question is from Paul Go. Paul, you have been asked to unmute.
Thank you, Director. Can you hear me okay?
I can't hear.
We can.
You can, okay. So I wanted to check with you about testing regionally. What are, especially in the Southwest, what are some of the concerns you have about as the cases go up, as the tests are collected, for getting the results back and some of the other things that you have that have been a problem in the past? Where are we now with that situation? Thank you for the time.
Certainly. My biggest concern is that individuals follow the good public health message that we have out there in terms of social distancing and wearing a mask. As it relates to testing, we've heard that there are sometimes delays in getting the test results back and getting them to the patients. Some of those delays have to do with supply chain, things such as the plastics that are needed in test kits or the reagents that are needed to do the analysis of the test. Some are just simply until we can get a contact tracer to reach out to you. As I said, we're prioritizing the individuals to reach out to first, those individuals at greater risk. I can tell you that back in April and May, the turnaround time was not acceptable, and it sometimes could be a week or more. We have done a fairly good job working with our testing partners, and results are generally within 48 hours, 72 hours. So it's something that we constantly look at. We constantly work with the suppliers on to assure that the supply chain is there and that we can get these results back. Because until we have the results, we can't do the case investigation and contact tracing.
Thank you. Next up is Jamie Martinez. Jamie, you have been asked to unmute.
Hi, thanks for taking time for us today. Question related to contact tracing. We've heard over and over again that people are not picking up the phone, they're not participating. Is the state considering any other avenues to getting through to people? I'm thinking something along the lines of census workers who will show up and knock on your door, and I realize with social distancing that's not desirable, but any other ideas to get creative and get people to participate in this process?
We have discussed this at great length, and obviously we have a wonderful COVID alert app that we would encourage people to use, and it is a Bluetooth enabled device, and you're able to report your symptoms and get notifications on your contact status through that app. In addition, we plan to, obviously, every opportunity we get, to discuss the importance of contact tracing, case investigation, and stress how confidential we keep the information. This is a very difficult time right now. Public trust is not as great as it needs to be. We want to be completely transparent, try to earn the trust and maintain the trust. Part of this is every opportunity we get to speak, we talk about the importance of case investigation and contact tracing. We're planning to do some media around that so that we can better explain what this process is about, and it's not something to be feared. Thank you.
Next up is Barbara Barr. Barbara, go ahead and unmute.
Yes, hi. Thank you for your time. I wanted to ask you, I heard you mention about people with symptoms getting tested. What about asymptomatic people who are spreading it unknowingly? Your recommendations on that, and where do we stand in the development of a test where you can administer at home?
Great questions, very timely questions. Let me address the issue of asymptomatic first. Clearly, there are a lot of individuals out there that do have the disease, have no symptoms at all. And that's why our public health message, our message of masking and washing hands and avoiding crowds and social distancing is so important. Because if we can keep individuals away from other individuals, if they have the disease and have no symptoms, we can help to control the spread. We do have surveillance testing that is happening. They happen often in the university settings, and they happen in other parts of Pennsylvania. And what that does for us is it gives us an idea of where the disease is and how prevalent it might be. The last question that you asked was the at-home test. And just today, I read that the first rapid test, home test kit is going to be available. I can't tell you when that's going to be available, but I do know that it has been approved by FDA. That test is for symptomatic patients only, and that test does also require a physician's order. But it is an at-home test, easily taken, and then sent back to the company. I think what you'll see as we move forward, as technology is changing with testings, you will see more of this type of test occur, and we're very anxious to have that as another tool in our toolkit.
Thank you.
Next up is Mike Rubinkamp from the Associated Press. Mike, go ahead and unmute.
Hi, thanks for doing this. The state has a goal of contacting a positive case within 24 hours. That's only happening in about 25% of cases right now, down from 80% of cases over the summer. Is this an indication to you that the contact tracing system has become overwhelmed? And what is the public health impact of that, and what is the state doing about it?
Thank you. Certainly, as the number of cases increase, and we have seen a significant increase not only in Pennsylvania, but across the country, it does put an increased demand on our case investigation and contact tracing. What we have done is we've really done a great job of reassigning other folks to help with the contact tracing. We monitor the percentages as you have on a regular basis, and that's why we've taken the step, recognizing that as cases increase, as people are going to be more busy doing the case investigations, so we really have to prioritize. And the prioritization works for us. It will be our goal, obviously, as we can continue to ramp up our contact tracing capacity to be able to do better in terms of that percentage. But let me mention to you that in Pennsylvania, we have over 1,600 contact tracers. And we have 150 community organizations and stakeholder groups who also have contact tracers that support our initiatives, as well as those individuals in universities and other organizations that do their own contact tracing. Thank you for that question.
Thank you. Next up is Harry Lee from Fox 43. Harry?
Hi, can you hear me?
Yes.
Hi, thank you for talking with us. My question is, again, about turnaround time for those tests. You said that it before was in the spring unacceptable, and now it's generally within 48 to 72 hours. But I believe that the problem in the spring was that because there was such a flood at that time in Florida of need for testing, that's what brought the wait time up. Have you negotiated with the national companies to try to get Pennsylvania priority, or made other plans to make sure that the turnaround time doesn't go back up so people aren't waiting?
Thank you. Yes, actually, the supply chain challenges that we have are something that we monitor constantly. And Governor Tom Wolf has been so supportive in terms of penning communication to the HHS secretary to stress the importance of making certain that the supply chain for whether it is, again, the materials making the test kit or the reagents that do the analysis are available. I personally, with other leaders in the governor's office and the Department of Health, have had conversations with some of the larger companies about what their challenges might be and what their plan is to mitigate those challenges so that we can have our PCR tests done in a timely fashion. Let me just also mention that as a result of some of these challenges, that's why you're seeing more of the rapid antigen tests. You're going to see more of those. They don't replace the gold standard PCR, but they are an outstanding tool for us to identify where disease is and to mitigate that disease. Thank you.
Next question is from Nicole Brambilla from Lancaster Newspapers. Go ahead, Nicole.
Thank you, Director, for taking my call. I had a question about the lack of response from your case investigations. I have a couple of questions. My first one has to do with, have you noticed that there's regional hotspots, per se, that tend to not answer the phone call, or is it widespread? And then related to that, it looks like from information that Nate Wardle has supplied to me that we may have only hit nearly 50% response. Have we had a better response rate since you guys began doing the case investigations?
Yes, thank you. That is our challenge, and I would describe that when you look at the age group of 18 to 35, somewhat reluctant to return calls, somewhat reluctant to share information. Again, it may be a trust issue. I can't describe it as being regional, but I can describe it that there are certain folks that are more likely to pick up a phone than the other. Let me use a practical example. My cell phone. If my cell phone rings and I don't identify the number, I generally don't answer it. I let it go to voicemail. And unfortunately, that may be what others are doing. So we're trying to address that issue so that we can see the Department of Health calling or a county health department calling so that they're more likely to pick up the phone. What I would really like you to do, representing newspapers, is to really put the word out that when the phone rings, when the health department calls you, when you think you were a contact, either get on that app and put the information in or answer the phone. Thank you.
Nicole, did you have a second question? Next question is Jim Melwer. Jim, go ahead and unmute yourself.
You've mentioned a couple of times how effective surveillance testing can be, not to replace PCR. I'm going to try to ask a very narrow question here, and I hope you go where I'm asking. An epidemiologist from Harvard named Michael Minna has been calling for the use of cheap paper strips for that purpose for months. Cheaper and easier, more scalable than the Abbott tests. And he says that if these were adopted and if 50% of the population used these tests every 4 days, it could stop outbreaks before they start and be as effective basically as a vaccine, replace the difficulties with contact tracing. And he says that state government could adopt these, even though the FDA has been hesitant to do so, that as part of a health emergency, state governments could adopt them. Has Pennsylvania looked into these cheap tests, and if not, why not?
I can tell you specifically that test, no. It's not something I'm familiar with. However, I am probably every week I'm in contact with 4, 5, 6 new types of testing that is available, both molecular and antigen testing, and we're constantly looking at two things. We're looking obviously at the accuracy. We want tests to be as accurate as possible, and we're looking at the cost because it's very important that we're good stewards in terms of the financial. But our greatest priority is to get the best test, to get the best information, to control disease, save people from getting sick, and people from dying.
His point with that is they're not on par with PCR, but the frequency, if used often, makes them reliable, at least in the surveillance part of it. And so when you say they're not as reliable as PCR, well, that's a high bar, but the frequency and the cost effectiveness, does that factor into your equation, and why has it been so difficult to adopt a cheap, simple test?
Again, I am not familiar with that particular test, but as you know, a test is a snapshot in time, and therefore that's why his premise is that you test frequently, you're going to be able to get basically an idea of where someone may turn positive or where they aren't, and I understand that. I look forward to researching that more, and hopefully I'll have an answer for you in the future. But I appreciate you bringing that particular study up, and I'll commit to researching that and see what I can find out.
Next up is Wallace McKelvey from Penn Live. Go ahead, Wallace.
Hi, thank you for taking my call. I wanted to ask you to elaborate on the prioritization of these case investigations and contact tracing. how do you decide which cases, like specifically, not just at risk, but like what is the process for deciding who gets a call?
Absolutely. So we're looking at the people that are absolutely most vulnerable. So I would describe to you that individuals that live in long-term care facilities in congregate settings like that have the potential not only to spread the disease, but potential for death. We're looking at people that have significant underlying health conditions, comorbidities, that, again, if they had the disease, it could result into more serious illness and or death. We're also looking at outbreak management, so that if I identify a county that has a significant outbreak, then I will obviously want to do the case investigation and contact tracing there next to control that outbreak. And then any other individuals that come in, and the final tier would be those that have died. And we would also do the case investigation on them.
And a quick follow-up question. It looks like some of the data that I see in front of me, 21% of confirmed cases provided an answer to questions about like where they spent time in a business. In that, do you know if that number, like, are you reaching out to every confirmed case because you are prioritizing?
That is our goal. Again, in the order of priority, that is our goal, to reach out to every confirmed case.
Our last question today, it will be from Jen Rahill. Jen, go ahead and unmute yourself.
Hi, thank you for taking my question. The Allentown Health Bureau today sent out a notice saying that positive COVID-19 results are coming into the Bureau faster than staff can keep up with reaching out to close contacts. And in fact, they're asking people who've tested positive to reach out to people who've been close contacts. Is there any additional support going to be sent into Allentown? It sounds like their contact tracers are overwhelmed if they're asking the patients themselves to do some of this work.
That's a very important question. And in fact, there is assistance. And we have actually had requests from not only municipal health departments, such as Allentown, but county health departments as well, where they are becoming overwhelmed, as I described earlier. And this is where we are able to mobilize any number of those 1,600 contact tracers I talked about, as well as community organizations, the stakeholders, the partnerships that we have. We have regional, I'm going to call it a coalition. It's a contact tracing coalition, and we have them regionally throughout the state. And we meet on a regular basis. And this is what we discuss. And they help to mobilize resources to assist, whether they're a county municipal health department, whether they're a federally qualified health department, whatever the case may be. Thank you.
If I could ask a follow-up, reading this, it raised the question is there a point at which community spread gets so rampant that contact tracing is no longer effective? Is there a tipping point at which it's not going to be the mitigation that's needed to contain the virus? And what would that tipping point be?
Contact tracing is still one of the most important tools. Obviously, testing is number one. The case investigation and contact tracing fits very closely with that. It's one is dependent upon the other. Regardless of the number of positives we see, we will continue to do contact tracing. We will exhaust the list of positives until we can be assured that disease is controlled. Understand that we have an incredible spike in cases. We have not flattened this. This is a very dangerous time. So we have no intention in slowing our contact tracing. We will continue to do that. We'll do it by prioritization. And I assure you that that's not something we're going to stop.
Thank you so much. Do you know specifically if any support is being marshaled for the Lehigh Valley in terms of this, or could someone get back to me about that?
I can tell you that when I leave here, that will be one of my first questions, and certainly we'll be happy to follow up with you.
Thank you so much for joining us for today's briefing. This briefing has been recorded and will be available on PAcast. Tomorrow's briefing will be at 12:30, featuring Dr. Rachel Levine talking about vaccinations. Reporters can RSVP to the Department of Health press office for participation in that media event. Thank you so much.